What's up, everybody? Welcome to the video. So today I wanted to review something with you guys. We get a lot of questions when it comes to utilizing a foam roll. So I have a foam roll here. And I just want to kind of shore some of those questions up and tell you a little bit about how we utilize these for our patients in our office. So the foam roll, so the term that is utilized for foam rolling is self-myofascial release. Obviously, this is something that you can do for yourself, so that's why it's termed that. There is a little bit of a misnomer with that. It's not really a form of myofascial release. We're not actually releasing or changing any of the connective tissue, so we probably should put that out there. Not that it's not valuable, but there is a little bit of a misnomer there. A lot of the benefits when it comes to change in mobility are relatively short term, but if they're used right, they can actually be pretty beneficial. So, and I'll just show you some of the other tools. So obviously I got a foam roll here, okay? Another one that's pretty popular is Lacrosse Ball. So when we use different things like these, so some of it is just more practicality than anything. So, right, this is a little bit harder, much more dense. So this might not be as comfortable if we're working like the outside of our leg or along our IT band or something like that. But it's great if we can use a little less pressure and maybe work our foot, the bottom of our foot. This not so much on the bottom of our foot. So a lot of it is just kind of practicality. So there's the Lacrosse Ball there. Another tool that I have here is this is a massage or a self-massage wand. This one's made by TheraBand. It's a really good product. Obviously you can kind of hold on. So again, some of its practicality, say there's an area that you don't want to use your whole body weight on. You want to be able to hold and actually roll along the tissue. This would be maybe a better, more practical way to do it. So there's a bunch of these out there. So the most popular one that we see, it's been around for a little while, it's called the stick. It looks just like this, where it has the handles and it's got some white beads kind of along the middle. So that's the probably the more popular version of this, but this one actually works really well too. So, okay, so but when it comes to these guys here, some of the questions that we get are when should they be used? So the answer is, well, it depends. So what is the goal? So we know that there's two things that utilizing self-myofascial release can accomplish. The first one is it can improve mobility, like I had talked about. And even though it's short term, if you think about it, if you want some short term benefit, the best time to use that would be before activity or before your workout. So unlike static stretching, which is we rarely recommend it as a form of warming up, because we know that it may help with range of motion, but the other thing that it does is actually takes away from your muscles' ability to contract. So you lose a little bit of power. And what it's been shown with myofascial release is you don't actually lose that. So you can still get some mobility to the area that you work, but you don't lose that contractibility. Which is really important, before you go into a workout. So that's probably the biggest benefit of doing it before you work out. If the other benefit of doing it, of utilizing self-myofascial release, would be to decrease the effects of muscle soreness. So think of you had a really hard workout, and the next day you're really sore. Usually the following day you're really sore. So the term is delayed onset muscle soreness. So this has been actually shown to reduce the effects of that as well. Maybe you guys experienced that yourself. So if you go through a workout and you go, wow, I'm really going to be sore from this, or I'm doing movements I haven't done in a while, then the best time to apply foam roll or Lacrosse Ball or any other form of self-myofascial release would be after your workout. So those are that's probably the biggest question to do, is when's the best time to do it. And those really are the biggest benefits of it. So a couple other things too. It's not really meant to be something really painful. So obviously when you might get on an area and it might be uncomfortable, it's not a no pain, no gain. I mean, there's been studies that have shown if someone deems the sensitivity a 4 out of 10 versus a 9 out of 10, the 9 out of 10 doesn't benefit anymore from going just that harder on it. So the idea is just to get pressure on an area, and like I said, it doesn't have to be a lot of pressure, and you get some roll through there just to really get the job done. It doesn't really have to be anything more than that. So it doesn't have to be super painful. So keep that in mind as well. So, but we utilize this in a lot of our patients' treatment plans. So even the result of improved mobility is short term, if you think about it, if somebody has some irritation with some type of movement and we're working in the office to help improve that, we want to give them things in between their visits to work on. So foam rolling, lacrosse ball, things like that can be very valuable as the part of somebody's treatment as well. So hope that answers some questions for you guys. If you have more, please let us know, and we'll be happy to answer those for you. So hope you enjoyed today's video, and we'll talk to you next time. Thanks.